requesting. So before starting in a short introduction on ICS. So ICS, as you all know, is a psychology organization and we work in two departments. First is one-to-one counseling department where we provide counseling session, and second is a training department where we have several diploma courses, therapy or internships for the people who are eager to learn the psychology.
आप भी सुनना चाहेंगे?
Please mute yourself. Okay. So today we have a webinar on clinical psychology, and I request all of you to please be there till the end of the webinar because we are going to share the procedure for the certificate at the end. So those who all are present till the end would be receiving that procedure certification of how to get the certificate, and it is compulsory to turn on your camera throughout the session in order to receive the certificate. So again, I'm requesting all of you to please turn on your camera so that we can start with the session now. How to get the certificate, we are going to tell at the end. So for today webinar, the trainer, her name is Sonali. She is RCI licensed psychologist. She also conducts corporate trainings. She's a child psychologist and she's happiness coach. So I request her to take this session now.
Thank you so much. Very good evening, everyone.
Good evening, ma'am.
Good
evening,
ma'am. Good evening. Can I
Good
have
evening.
everyone on the
Good
screen
evening.
quickly?
Good
A very
evening,
good
everyone.
evening.
Hi.
Hello. So, are you all aware about the topic for today?
Yes.
Yes,
What is the topic? Can I
clinical
hear?
disorder.
Clinical psychology.
Okay, clinical psychology. That's like a broader term. Today, we are going to cover something related to understanding of the diagnosis of clinical disorders. Like, why is it important to diagnose and just not ignore? Okay. And what is the process that we undergo with respect to that? Okay. So, before going ahead with the main part of the webinar, can we have a quick round of introduction with just telling our names and what do we do, where are we from? Pratibha ma'am, can we start with you?
Yeah, my name is Pratibha Betkikar. I'm working actually in a pharma company. I stay in Virar, Maharashtra.
Okay. All right. Pinky ma'am.
Thank you.
Yeah, I am Pinky and I'm from Kerala.
Hmm.
I'm working as a teacher.
Okay. Okay. All right. Yes, next. Deepti ma'am.
Hello, ma'am. I am from Odisha and I am an administrator in school.
Okay. All right. Shivangi.
Good evening, ma'am. Hello to all. This is Shivangi Agarwal. I am pursuing my bachelor's right now. I'm in graduation and I'm from Chandigarh.
Okay. All right. Jasmine. Can't hear you, Jasmine. Your voice is not coming. It's very low. If you have any device, just remove that once. Yeah, maybe you can remove and then speak. Okay. Uma ma'am, you can fix it, then come back. Uma ma'am. You are muted, ma'am. Uma ma'am, you are muted. Can't hear you.
Okay, yeah. I am Mrs. Uma Sriram from Jamnagar and I am a freelance special educator.
Okay. All right. Bharti ma'am. Yes, ma'am. Bharti Devi ma'am. Am I audible?
And yeah, this is Bharti. Have completed my MSc Psychology and I'm from Chennai. Right now, I'm working in SEZ Zone, Jaya, as a psychologist.
Okay, all right. Yes, Shamli ma'am.
Hello, ma'am. Good evening.
Hmm.
I'm from Lucknow. I have done my BA BUs in from Bhatkandi University, and right now I am working as a teacher.
All right. Vibhuti.
Hello, ma'am. I'm Vibhuti Jain from Narsinghpur, Madhya Pradesh. I'm housewife, but I'm about to open a kindergarten.
Okay, all right. Belinda ma'am.
Hello, I'm Belinda. I'm from Chennai. I've finished my BA, BEd, and I'm a homemaker.
Okay, all right. Bijal.
Hi, my name is Biju. I'm from Pune, and I work as a senior service delivery manager in one of the IT firms.
Okay, all right. Adya.
Hi everyone. Good evening, ma'am. My name is Sri Devi. I run my own preschool in Bangalore.
Okay, all right. Rename yourself then.
Madam?
Virginia.
Good evening. I'm Vijay Satish. I'm from Bharuch. I completed MS Technology. I'm a homemaker.
Okay, all right. Anaz.
Hello, ma'am. I'm Arnav Sheikh from Mumbai. I'm doing an undergraduate course of psychology.
Okay.
Good to see
all
you
right.
again, ma'am.
Vinay, same here. You are muted, Vinay.
I am Vinay Yadav. I am from Haryana. I have done MA in political science and currently I am looking for a job. That's it.
Okay, all right. Rashi.
So, hello ma'am, I'm Rashi. I'm from Uttarakhand and basically I'm doing masters in clinical psychology from MIT University.
Okay, all right. Janvi.
Hi, good evening, everyone. So my name is Janvi, and currently I'm pursuing PhD in psychology. And side by side, I'm working in Rajiv Gandhi Cancer Research Institute as a volunteer.
Okay, all right. Raj sir.
Good evening, ma'am. I am Rajkumar from Punjab, and I am working as HR manager in Jagjit industry.
Okay, all right. Naidu. Anjali. Jasmine, are you done?
Yeah, can you hear me?
Hmm.
Yeah, so I'm Jasmine here. I'm pursuing masters in clinical psychology. I'm almost done, so I'm waiting for the results.
Okay, all right. Neha.
Good evening, ma'am. I'm really sorry. I won't be able to switch on my audio and video for this session because I'm out now, actually. But I really wanted to join this webinar. I've joined your child psychology course, so I've been in class for the last 2 days. I've done my master's in psychology, and I'm a teacher by profession. I'm a kindergarten teacher by profession, so I'd really like to, get more information and learn more through this webinar. Thank you.
Okay, all right. Okay. Anyone else who would want to give a rest can be marked quickly absent then. Hina.
Yeah, good evening, everyone.
Hmm.
I'm not able to open my video. However, let me introduce myself. I'm Dr. Shankarachari from Hyderabad. I'm MSc Physics and MEd and PhD in Inclusive Education. I'm a school administrator, counselor, and trainer. Thank you.
All right. Anyone else?
Hello, ma'am. This is Ati.
Good evening, ma'am.
Yeah, continue.
I'm Evangeline and I'm doing my master's. I'm apparently not able to turn on my camera because of the connectivity. And I'm
माझी
here.
फोन करते मला
Hmm.
सॉरी
Go ahead, go ahead.
Hello, ma'am. This is Ati. I
Hmm.
just did my master's in counseling psychology, and I'm
What's
in
your
Nagarjuna.
name?
It's Ati.
ATTI.
ATI, ma'am.
Okay. Hmm. All right. Yes. Anyone else?
Hi, ma'am.
Hmm.
I am Indu from Kerala.
Hmm.
Working as a teacher in Amrita Vidyalaya, Perumbavoor.
Hmm.
Okay.
Okay.
I want to learn more about psychology.
Okay.
Hello.
Hmm.
Hello, good evening, ma'am. This is
Hmm.
Amreen from Uttarakhand. I'm a
Hmm.
government teacher and currently I am doing my master's in psychology.
Hmm. Okay. Yes. Who else is left?
Should I also introduce? I introduced yesterday. Should I also introduce?
Today is not the class, ma'am. Today is the webinar. So please introduce. They are all new, different people.
It's my second day today.
Ma'am,
Ma'am,
today
I'm Shan Anthony Gomes.
today is the webinar. It's a different topic. It's a different thing today. That's not a part of the class today. Okay? Please give your introduction here.
Okay. Yeah, this is Hina Vashni Raut from Bhopal. I run my educational institute named as Shri Bhavans Bharati Public School for the last 18 years, which caters children from 2.5 years till 17 years old. And I have joined the psychology of the children because it is a big responsibility to deal with children who come from various backgrounds, various economic setups. So the whole objective is to learn about the psychology and how to convince parents whose children have some disabilities or who look for some external support or extra support, but parents do not agree. So I need technical way of convincing them to make them understand about the issues or to address the issues gracefully so the child and parent both do not feel offended. Thank you.
All right. Yes. Anyone else who is left to give their introduction?
Good evening, ma'am.
Hmm.
I am Shan Anthony Gomes. I am from Kolkata and I am a teacher. Thank you.
All right. So our topic for today is something related to clinical disorders. Any idea what are clinical disorders?
Schizophrenia.
That's an example. But what is a clinical disorder?
Clinical disorder is something that obstructs your daily routine that any regular person is able to do in a way, either mentally or physically. It obstructs your daily routine in different ways.
Okay. So
And to
one
add
thing
on
that you
to
are
that,
saying that, okay, it interferes with your day-to-day activities. Okay.
we require some kind of a medication to
Okay.
support our day-to-day activities.
Okay. But what is a disorder?
Ma'am, it's abnormality when we do not function according to what we feel like or what we actually want to do.
Yes. Right. So why do you think a diagnosis is important for that? I think if that's an abnormality, as we say, we can all function somewhere or the other. And we know, okay, he's not able to do or she's not able to do certain things. And I think we all can deal with it and live with it. Why do we need a diagnosis? Why do
So
you
that we
think a
can find
diagnosis
out
is important?
that we can find out the
Because
root
disorders
cause
resist
and
our possibilities, ma'am.
Okay.
We can find out the
For
root
better
cause and treat it.
functioning.
For better functioning, okay.
We can
To
find out the
treat
root cause and treat
to
it.
treat them.
Diagnosis is important for treatment.
The
It's
patient may
important
face serious issue if it's not diagnosed or addressed properly. So
Because currently I am suffering from OCD, ma'am. That's why uh, uh, I wanted to know about more disorders.
okay. What else? So maybe treatment can become smooth, maybe identification can happen, management plans can be made. What else? Do you think early identification is a good idea, or anywhere it should be diagnosed somehow or the other?
no, early diagnosis is very important to identify the disorder, and it need to be treated properly in the earlier stage itself. Otherwise, they may face serious issues in the future.
Yes. Okay. So whenever a client comes to you, what is the first thing that you do?
We make them comfortable.
Taking the history of an individual.
Yeah.
Make them
Introduction of the
comfortable and
person.
establish a rapport with them.
Having a good
Rapport
rapport with
building.
them initially, rapport formation, right? And then post that
Yes.
case history. Understand the case. What is exactly the concern, right? Once we have understood the concerns, then we move to, if any assessment that is required, then we move for that. And then once that is done, post that we check, okay, maybe this is based on my observations. This is what the conclusion of the assessment also is there. And both are in sync. That means that the client is undergoing XYZ disorder. And where do we check what our client is undergoing, which disorder? Where do we check? Any idea? Is there any manual? Is there something that we refer to? Just giving you a hint. Those who are from psychology background, I think should be knowing.
DSM-5,
DSM.
ma'am.
Psychometric manual.
DSM-5.
DSM-5, TR, now the recent version, or ICD-10, right? These are being used. Okay, what is the full form? A lot of you are not from this background, so for them, I just would want to check. What is the full form of DSM? Diagnostic, Statistical, Manual, right? That is, so the recent version is DSM-5 TR, which is the revised version. And ICD-11 is the recent one. What is the ICD ka full form?
International Classification of Diseases.
And 11 is the recent version of it. Okay? Mostly still right now also people are using 10, but 11 has come up and people have started using that as well. Okay? So these are the ones with where we check what is the diagnostic criteria, and if the client meets the criteria, then we officially diagnose him as XYZ disorder. And then post the diagnosis, we start with the treatment plan of action. Where exactly are we heading? What is our plan and how do we plan to go ahead? How many sessions will be required? Whether the client requires just counseling, whether the client requires medication, counseling. So if the client requires medication, sending them to the psychiatrist for a checkup. First, even before the diagnosis, first thing is, has your client been medically ruled out or not? That's also something that's very important for us. Like, for example, if a client is having some symptoms which might have some comorbidity that could be present. For that, have we ruled out the medical disorder or not? Have we ruled out the medical part? Is your client medically fit? Then only coming to a conclusion where, okay, these symptoms are then psychological. Yeah. Lot of times, they get somatic symptoms, which at times becomes confusing for them. Yeah. So where medically rule out definitely becomes important. Also undergoing any test, hearing and eye test should be done, should be checked that, okay, Even when we do assessments, like if we do assessments for when we are assessing learning disability as a disability, right? So before that, hearing and uh, the eye test is very important, just to see whether if hearing and eye test is okay, that means that the client is actually having a lot of visual spatial issues only. It's not vision, it's more of a visual spatial concern. So those are the things where we can get information from. So first things that we have to rule out the medical part before going into any kind of psychological diagnosis. Okay, so just what I explained to you right now as a whole process, this is where we will go in. The role of diagnosis in psychology, it gives us definitely a clarity in understanding. It helps us in guiding in the treatment plans so that we have a clear and accurate diagnosis. It enhances clear communication. So a lot of times there is multidisciplinary team that works together for maybe one particular client. Maybe psychiatrist is also involved, an occupational therapist, or maybe a physical therapist is also involved. There are a lot of many other concerns that could be present. So ensuring that clear communication happens between all sorts of professionals, so that from diagnostic perspective, it enhances communication skills, which is very, very important. The importance of accurate diagnosis. First is effective intervention. Accurate diagnosis is essential for providing appropriate and timely interventions for patients' mental health concerns. It reduces stigma. Definitely, there are a lot of. How many of you feel that we are still living in a stigmatized world where a lot of stigma is there? Although there has been a lot of improvement with respect to mental health, but still, are we far or we are there?
We are far off.
We are
At
far off.
least there is a long way to reach.
We have a long way to go, but I'm very happy to
Yes.
see all of you who are there to put in your effort, to put in your way where you actually think that, okay, I want to bring about a change in the society. And that's why I think you would have opted for this. Yeah, I think all of you have that intent. So we are all there working towards breaking the stigma and reaching out to as many people as we can. So yes, definitely that gives us a clarity if we have an accurate diagnosis, that yes, we can also have a clear diagnosis, and it's not something that we need to be scared of, and make more people aware that yes, this is the concern, this is how the plan of action is, and this is what the client is going to undergo, and we can deal with it together. In promoting awareness, ensuring awareness about specific clinical disorders and their impact on individuals and communities. A lot of times, what happens is one person in the family who is ill, okay, maybe who is undergoing a diagnosis and maybe in the process of identification, the entire family has lot of mental health concerns. Why? Because their whole life revolves around them. Just imagine, just because of one person, their regular visits, their so it's like more of a doctor hopping initially until you get a clear diagnosis. Okay, let's go take a second opinion also. Oh, let's go take a third opinion also. Then they visit multiple doctors, then they get lot of tests done, lot of ruling out. So one person and the whole family is running around. So if there is a younger child that gets neglected, there even so of course everyone has their own work, and post work this is the main target. So a lot of things that get, so they even don't get time for themselves. They are not, their socialization gets impacted, that they are not able to pay attention to themselves, and of course financial burden is definitely there. Yeah. So think from all those perspectives. So promoting awareness is very, very important for us, so that more quickly acceptance will come, the more quick understanding will come, then this doctor hopping will also decrease. And there will be trust, faith that, okay, this is where we are going to go and this is what the plan of action is. And then there'll be more people that will be aware that, yes, something like this happens and this is how you can deal with it. So the entire family members, also you guys being the psychologist or the counselor, can definitely guide through with the families as well and make them more psychoeducated. That yes, this is the diagnosis and this is how we are going to move ahead. And these are the symptoms that your client is or your family member is experiencing. And we understand, and these are the ways that you can handle the situations better. So they'll also get a clarity on it. Although when we diagnose, there are a lot of challenges that we observe with sometimes with different kinds of symptoms, sometimes complex comes in, and then there's some confusion. Maybe at times what happens is that maybe they went to some doctor who gave them some kind of medication, and then the effect of medication was like making the client drowsy. And when the client has come to us, we feel that okay, the client is having so much of low in energy, and we note that down, that I think that's not something that's appropriate. And then we give them some certain things to you know we give them some techniques where they could boost their energy first and they should feel better, and then work on their well-being and then move ahead with the main concern. So the time is being wasted a bit, rather, I would say, or because of the variability in symptoms, the actual concern could not be addressed earlier. So there could
I
be a
also
possibility.
left my medicines, ma'am. I also left my medicines, ma'am, because medicines can't work on me.
Okay, all right. I am not saying that you should leave your medicines at all. I hope I am clear. I'm not saying that. Yeah. I'm just
Yes,
saying that correct and appropriate treatment is required. If medication is required, then we should definitely consider medicine. And along with that, therapy definitely should go hand in hand. If any further thing is required, they should go ahead with it. Because one thing is not the solution to all the disorders. There is no one shot that, okay, like for example, we pop in a medicine when we have fever, and next
yes, ma'am.
in few hours, in 1 or 2 hours, we start feeling that, okay, maybe the fever is going down, the temperature is going down, and we start feeling better. Again, there is no pop-in medicine for any disorder. You have to have a lot of patience. You have to have a lot of resilience to understand, diagnose, and then go ahead with the treatment plan of action. Okay? So, and never ask your clients to leave the medicines very abruptly. That has lot of side effects, and that's not considered to be a good idea. There are some more challenges which are related to the cultural considerations, which can include understanding of the disorders. A lot of times people are there from different cultures and maybe the accurate analysis cannot be done. So a lot of times people just say, oh, the case has come to me, let me just take it up just as an exposure. And maybe the counselor or the psychologist is not even equipped enough for that particular culture. There could be cultural differences as well. So then also, if the cultural considerations are not done, then also there can be difficulties in diagnosis. Comorbidity complexities. What is comorbidity? What is a comorbid disorder?
Um, Problems like diabetes and, I mean, I don't know. I think
Yeah.
something to do
But
with your
what
head,
is
internal health.
comorbidity?
Ma'am,
Term. I'm talking about the term basic meaning. So
More
here
than
we
one
are here
disease.
more of an introduction to clinical disorders.
It's more than one disease.
Yeah,
Okay.
more than one, multiple diseases, multiple treatments or medications required.
Okay. Anyone else? What is comorbidity?
multiple disorders or diseases simultaneously.
Hmm. Okay. So comorbidity is when there is one primary diagnosis. Okay. And then along with that, we have certain features of other diagnosis as well. Like, for example, if we say that, okay, my client has depression. Yeah? Along with that, just like you guys were saying, he also has diabetes. He also has blood pressure concerns. He also has maybe one or two other things that could be there. So those are, maybe the features are there, they are not properly diagnosed yet. But yet there are some features that maybe at times the sugar fluctuates. So that could lead to, a possibility could also be there. So comorbid features bhi ho sakte hain, comorbid disorders disorder bhi ho sakta hai. So again, it will depend on case to case. There could be some mild features that, okay, maybe comorbid features of XYZ thing. Like if I take with children, if I take that learning disability is there, there could be a possibility that a comorbid disorder could be ADHD along with it. Yeah, ADHD is attention deficit hyperactivity disorder. So that is like a comorbid condition. एक primary diagnosis के साथ we can have 2 or 3 more other conditions as well. Maybe features भी हो सकते हैं, proper disorder भी हो सकता है. Okay, so both possibilities are there which go hand in hand. Are you all clear with this concept of comorbidity? So
Yes,
lot of times, lot of symptoms come in. Yeah. So all the features come in together, which makes it difficult for a diagnosis because the diagnosis becomes a bit complex. So this is where this could be a challenge while diagnosing. Impact of misdiagnosis. So when the diagnosis is not appropriately done. First, of course, our client suffers. Yes, there's a delay in the treatment, which maybe worsens the situation at times. Yeah. Prolonged suffering. So like, for example, if I take a client showed very clear cut case of, red flags for suicide. And just imagine, because of slight negligence, the client attempts a suicide, despite you knowing that. So, do you think that's a case of misdiagnosis? There could be a possibility, or maybe negligence on your part. See, of course, incidents can
Could be a
happen.
possibility.
Nobody can be blamed, but yet knowing it very clearly, very clear cut, obvious signs, not doing anything about it, that could also lead to ultimately the client suffering. And because of delay in treatment, the client is losing their life. So again, prolonged suffering, lot of times, as I said, they do doctor hopping. So that improper or delayed diagnosis in the disorders that might have a lot of suffering. Erosion of trust. So ultimately, when they are not able to, tell you clearly that what exactly is the concern, the client also tends to lose out on trust with the professional. And then there is a mistrust between patient, healthcare providers, and then definitely impacts ultimately who is at loss if we look at it from a big perspective. Who is at loss? Your client or
Patient.
you?
Both.
Our client is at major loss. Yeah,
Yes.
he is the one
Exactly.
who is undergoing a lot of stress because yes, nothing is happening, nothing is coming to surface. Yeah. So benefits of early diagnosis, as you guys said that yes, it's a good idea to diagnose at an earlier stage. What should we do? It gives us improved outcomes, effective management plans can be done, and quality of life with people that becomes definitely better. When we look at the diagnostic process that I just told you about, what do we undergo when our client comes to us? assessment of our client's mental and emotional state, basically taking the history, understanding, diagnosis, categorization, identification of mental health concern based on the standardized criteria, treatment planning, collaborative, like for example, if any doctor visit is required, if any particular things are required to do, so doing that, and then devising a treatment plan. So the techniques that are used for diagnostic purposes, of course, is the assessment, as I told you, interviews, observations, behavioral analysis, neuroimaging, and neurofeedback. There are certain ethical considerations. We will be going in detail on few more things. Ethical considerations that are there in from diagnostic perspective is first is confidentiality, then cultural sensitivity. Why do you think we should keep our information confidential?
So that the client has
The
trust in
client
it.
may feel insecure.
No, why should we keep it confidential?
To establish the trust
Because
between the
client
client
trusts
and the
us.
doctor or the consultant, so that client opens up and discusses the issues clearly,
Yes.
confidently.
Client
Anybody
don't
else?
want to client don't want to embrace, ma'am.
Client
I
does
think
not wants to be embarrassed. Okay.
Yes, ma'am. Yes,
along
ma'am.
with that, we do not want anyone in the society or their surroundings to take their advantage or their situation's advantage.
Right. What else?
Ma'am, so that other people don't know that they're going through some treatment, because people might stigmatize or again call them or give them tags related to it.
What else? Okay. What is that one time where we are allowed to break the confidentiality rule? Some of you who have attended my sessions will be able to answer this.
Legal requirements.
Okay. What else?
When they are able to independently work upon themselves and accept their own situation, and they are too normal to be sharing about it, to conversate about it.
Okay.
In case there are any signs that maybe there is some sort of a danger to life, or maybe something of real concern that needs to be addressed.
Yes, if it is life threatening, and people around should know.
So any
When we
harm
need to
that is
speak to
being
psychiatrist.
caused, or maybe any red flag that we see of causing harm to oneself or to others, that is where we are allowed to break the confidentiality rule. And what we have to do is, okay, just in case if we see a suicidal case, that okay, maybe some red flags that we observe, what's the first thing we are supposed to do? What do you think in case of suicide? What's a good idea? What kind of environment should we create at home?
Happy environment,
Stressful environment?
stress-free
Stressful
environment,
environment?
happy environment.
Do you all
We can
think we
keep the
should create
patient.
a lot of stress? Oh my God, a
No.
suicide is about to happen. Making a big deal out of it. Should we do that? I think we should do that. We should panic.
Panic in the sense, maybe a little subtly on the inside. We cannot show that out to the patient, right? But this is like, if there is a suicide, possibility of a suicide, then without showing the patient, yes, it has to be addressed immediately. So there has to be haste on the side of the psychologist.
Anybody else?
The client should not be left unattended. Always should accompany with people around.
Yeah. Right. That's one thing, definitely. Should we clear the environment? Or should we keep all the knives, scissors, and sharp objects around the bed of our client to make it more easily accessible?
Clear the environment. Obviously.
First thing, call up their family or their immediate contact number, okay? And ask them to clear the environment. That's the first thing that we should do. And not make it obvious to our client. Take it normally Yet keep a tap on our client very carefully. What is he doing? Where is he going? Also, restrict the area such as balcony, terrace, restrict those areas where there could be more chances. Yeah? Not giving him much access to the kitchen area, particularly. Even if he is given access, that is there under supervision. Somebody or the other should be there to monitor. Okay? So, clearing all the environment, leaving all, keeping all scissors, blades, any sharp objects that could be a possibility, even as simple as a pencil or a pen. Those things should also be cleared out. And basically, keep things normal. Do not panic. That's also part of it. Once you panic, your mind does not works in a better manner. Yeah, you're not then calm. You're not able to. You are not equipped to handle situations more mindfully. Be mindful. Be careful on what you are doing. Watch your steps, and keep a tap on your client. Then definitely these are certain things that are required. And if you think that yes, the police needs to be informed, maybe if there's an attempt or if it's something that's really serious, then definitely do that. All the legal things should be clear and you should not be in soup. Okay? So those are some of the things that we have to take care, especially with respect to suicide. Again, there could be minor red flags that you see. There could be major red flags that you see. One day you will see that there are some major red flags that are there. And the next session, the client is absolutely normal. There could be chances of that. Yeah. So you have to be careful in identifying what is the severity and what needs attention. Again, informing their family should be done in all sorts of cases because you never know. Yeah, we might think, oh, the intensity isn't too much, but then what if? Yeah. So again, keep yourself safe. Informed consent. Why do you think it's important to have an informed consent? What is informed consent?
To tell the client that what we are doing and make sure that it's an equal thing. It's a win-win situation where we tell what we are doing and they can also give their input that they're okay to do with it.
Yes. So it should not be something like that we are only forcing them to do. Because you know what happens is if it's not the client's will, no, there will be no results. When we look at counseling, when we look at any therapy, it's always a two-way process. Yeah. So it has to be where you are also giving in your inputs, you are receiving the inputs back. So we should always have an informed consent, involve the clients in decision making process. That this is what we are planning to do, this is what you are signing up for. And then only it will be a good thing where the client is also involved and also their informant, whoever has come in. So especially with respect to clinical disorders, their informants have to be kept in loop. Okay, one question that I have, like for example, if we consider severe cases of clinical disorders like schizophrenia, then we consider bipolar, if we consider more from that, even depression for that matter. So, a lot of times your client comes in and you take history from the informant that who has come in. How would you talk to the client that has come to you? What are the certain things that you're going to check quickly?
I will first hear my client's perspective, like that client's story first of all, because there are some cases that family used to, hide some of the information and
Okay.
things कि जो actual में चीजें होती हैं वो दिखती नहीं है. They used to, pretend or show something else. So that is our first priority, that what the client is suffering from or whatever the situation is.
Okay. What else? What would you, okay, you've taken everything from the informant. What is it something that you would want to interact with? Have you all heard about the mental status examination? Have you heard the term mental status examination? MSE? Psychology students, so many of you just said that you have studied psychology.
Yes, ma'am. That is
What
the
is
first
it?
one. So it's examinations where there are basic things, okay, in the test. So it covers most of the things about like the behavior, like the preferences, behaviors, choices, your surroundings, friends' preferences, likes, everything. It is a very like go-to-go questionnaire type, not into the depth, but yeah.
Okay. So mental status examination. That's like a very important part of clinical psychology. Why do you think it's important is because that gives us a clear picture based on our observations with our clients as well. What exactly? So as soon as your client enters your room, enters your clinic, what all do you observe? Looking at the appearance. How is he dressed? Is he casually dressed? Is he formally dressed? Or is he messy while he's dressed? So, a lot of people have very messy hair. They've not combed since ages. They are, even by looks, they are looking very casually dressed. They've come to you. All the other members are dressed properly, except for your client. Yeah, very shabbily dressed or neatly dressed, very petite, formally dressed. There could be a possibility. All sorts of clients come in. So, how is it in appearance? How do they look? Are they tall? Are they short in height? Are they so weight wise also you can mention that okay, are they a bit on the higher side or they are very thin framed? How are they looking? Do they have any prominent features? Do they have any dysmorphic features? There could be a possibility. Okay. Next is with respect to speech. Okay. How is their speech? Is it clear? Is it unclear? Are there some misarticulations that are present? Lot of times, lot of clients we get who mumble a lot, who are not speaking very clearly. Sometimes lot of clients we get who talk very fast and we're not able to understand also. Or some who stretch very much while talking. Okay. So how is their tone? How is their voice? Some of them use nasal voice as well. So anything related to their speech that you observe, note it down. Okay. Then how is their rapport formation? Are they responding well? Are they not responding well? How are they going about it? Are they well mannered? Do they cooperate? Whatever you are saying, are they, going in sync with it or not? Or are they resisting? Oh, no, I won't talk to her. Go, let her go, let her go. Or they're running out. They don't want to sit. So that will tell you how is their behavior, how is their responsiveness, how is their rapport formation. A lot of them are very anxious. Why are we here? Why are we here? What are we supposed to do? Why have you got me here? Oh, then they will ask you 10 questions. They're very anxious. Okay? Note these things down. Then, are they rude in their behavior or are they polite? Simple decision making. Like, for example, if you just ask, would you want to have some water? Or maybe would you want to have some juice? It's a simple decision that can be made within seconds. Huh? How is their decision making power with simple things? Are they friendly? Are they quiet? Can they hold and maintain conversations? Like if I'm asking you something and you're responding, and then I'm saying something again, that is like a back and forth conversation that we can have. Are they able to do that or not? Okay? Attention span and memory. Can they hold and follow instruction? Like for example, if you say that, okay, I'm going to say some numbers. Can you repeat after me? Are they able to do that? Are they able to follow the instruction that you're giving? Can you tell me, can you pass that red packet from behind? Are they able to follow that? Passing that red packet? So for that, he has to get up, look behind, pick up the packet, bring it closer to you, and then give it to you. Can you pass that red packet from behind? That involves complex instructions. Are they able to follow simple instructions or are they able to follow complex instructions? Okay? This is how you can assess. Then based on their activity level, are they constantly fidgeting in their seat? Are they constantly rocking? Or maybe they have something in hand and they're moving it continuously. Yeah? Or maybe they're just not able to sit. They want to constantly roam around and maybe walk around. That means their activity level is above average. I think all of you are right now being seated. Yeah, so our activity level at this point of time, most of us, I don't know behind the camera, but yes, those who are there on the camera, our activity level is average right now. We are not moving much. We are there all listening, focusing. Yeah. So that's how exactly we can see our activity level. I don't know about the rest part of your body. Maybe you are shaking your legs continuously. Maybe you are making some noise. So all those observations are to be noted. Okay, so these are some minor details that have to be kept in mind. With respect to the mood and affect of the client, how is it? Is he pleasant? Is he happy? Or is he very tensed? Or there are no expressions, absence of expression. He gets very easily upset. Or maybe at times you might see that the client just starts crying. It's tearful. How is it? Next part is their orientation. Whether they are oriented to time and place or not. Everyone, one question. What is the date today?
15th Feb
15th February 2024.
15th February 2024. How many of you think it's 15th March 2023? None of you?
I don't think so.
What if your client tells you that? Is he oriented?
No. Yes, ma'am.
Is he oriented?
Yes.
No.
Okay.
If he says wrong date, then he's not oriented.
He's disoriented, obviously.
Then we need to further check in with some more. Okay, one mistake, it's okay.
Yes, it's
Okay.
common.
So at times when the new year comes in, okay, we give a grace period of 1 or 2 months definitely for everyone to adjust. Okay? We usually do that, right? Even I think I still make mistakes sometimes. Don't you all get confused at times while writing when you're specifically writing? The hand still goes 2023 and then you purposely make a correction. No, it's 2024. Yeah?
Yes,
That
it does
happens.
happen.
It happens.
Yeah.
Yeah. So again, if we think that yes, the client has given us some wrong information right in the first time, and you're thinking that rest of the things are doing okay, why not recheck rather than just quickly writing down that yes, he's disoriented just because based on one. Again, that will reduce the chances of misdiagnosis. The checking of the minor little details, using your brain while you are taking history, while you are writing down the observations, is very important. That's your role as a psychologist. Why is human intervention required? This is where human intervention is required because that's where our role comes in. What are we observing from our clients that we are seeing on a regular basis? Okay? We know that, okay, maybe by mistake he just said 15th March 2023. Okay. Sir, can you tell me what's your date of birth? Okay, let's hear from Pinky ma'am. What do you think? What's your date of birth? Don't tell the year, just tell the number and the month.
June 4th.
4th June. Okay. Arnaz.
26th July.
25th July. Shivangi.
12th July.
26th of July. 26th.
26th July. Okay. Shivangi.
12th July.
12 July. Okay, June, July, बहुत सारे हो गए. Let's ask somebody different. Vibhuti.
26th March.
Okay, March. It's coming on its way. Janvi, ma'am. Deepti, ma'am.
8 October.
8th October. Jasmine.
23rd December.
Okay, this 23rd December. So I think we got a good variety of it. Now, I don't know your birth date, so I can't really cross check. But yes, for your client, you can cross check with the informant to us. Come, that yes, whether the client's birthday is in sync or not. Okay? Lot of
Mine is
times,
1st
let me.
October.
Okay, 1st October. All right. So we've got a whole bunch of different variety of birthdays now throughout the year. I think few months are left. I think Jan, Feb का किसी ने नहीं बोला. Rest I think all are done. So yes.
Mine is 2nd
Any
Jan.
2nd Jan, okay. Anyone's birthday in Feb?
Yes, ma'am. 19th February.
19th February. So just about to come.
Yes, ma'am.
Birthday plan
22nd
sorted?
August.
Okay, August also. Great. So, yes. So, checking in from your informant, this could also be a good idea. And there are a lot of activities that you could do for attention and concentration. Maybe you can ask them to repeat some numbers. There is a series 7 activity that you could do. Like, for example, you ask them that, okay, we are going to start from 100. Can you subtract 7 from that? And then again 7, then 7, 7. So make them do until they reach an error stage. That's another activity that you could do. This is for checking their attention, concentration. All these are part of the preliminary screening that you could do as a part of, your clinical skills when you meet the client. And also just generally checking him. What did he eat for lunch? If he's come to you in the evening, what did you eat for lunch? Do you remember? Oh, what did you have yesterday for dinner? As simple as that. Oh, what's your favorite dish? Try and interact. The more you interact, the more information you'll get in from your client. You'll be able to see whether he can relate to conversations or not. A lot of times when they are disoriented, they might have difficulties in, so they might say one sentence, the other sentence that they are saying, which might not have a connection with the one that they previously said. There could be a possibility. So start analyzing from those perspectives as well. So look out on those lines. Next, as I was telling you that coming back to the diagnostic tools and techniques part, psychometric assessment can be done, maybe to assess the cognition, emotions, personality, behavior. Observation is one method. Neurocognitive testing could be done to assess their memory, attention, executive functioning. Structured interviews, self-report questionnaires, semi-structured interviews, those could be part of it. Then psychological testing and assessment, objective test could be done, personality test. I think all of you must be aware and have heard of these techniques. Projective techniques, these could be some of the areas where the testing can be done. Neuroimaging and brain scans, MRI जिसे कहते हैं, I think everyone would be aware, should be aware rather, I should say. ठीक है? It provides a detailed image of brain scans and abnormalities that are present. It offers a detailed cross-sectional views of the brain for diagnostic purposes. So we always, in such cases where we feel that yes, we require any medical support, we should definitely refer them to a psychiatrist to rule out any kind of medical thing that is there, and we need their guidance. So they should always be in loop. So a lot of times identifying any genetic variations associated with specific mental health conditions. Then again, biological indicators, proteins, neurotransmitters that are linked to the mental disorders. So just to check in that, direct observation, behavior rating scales, these could be used for the part. Cultural considerations in diagnosis, it is very important to keep cultural aspect in mind, and language and communication should be correct so that misdiagnosis does not happen. So there are a lot of limitations when we look at the DSM-5 particularly, or maybe ICD-10 also. Lot of times, if we just look at the criteria, overdiagnosis happens. Our brain constantly thinks of the diagnosis only. We don't consider it practically at times. So overdiagnosis could happen. There could be a cultural bias scenario. Then any particular pharmaceutical company could be favored, or maybe if some medications were promoted. So that could also be one of the area where, the medications were given here and there. Because of that, there could be some loosening of connection that could be there. Okay, before I conclude, one task that I would want everyone to do is right now. Can you all in the chat box quickly write down some of the disorders that you are aware of? Some of the clinical disorders that you're aware of. Examples, basically. Okay, mood disorder, OCD, what else? Antisocial personality disorder, okay, conversion disorder, depression, okay, anxiety, PTSD, okay, autism, ADHD, mood swings, schizophrenia, okay, SCD, SLD, autism. Okay, so I think most of you have heard somewhere or the other that these are part of the clinical diagnosis. So we have a course on clinical psychology. So this was just for you to have an introduction about the basics and why is it important to have a clinical diagnosis. In there, we cover all the clinical disorders in detail, one by one. And you can check with your academic counselors for the further details of the course. Okay? So thank you so much, everyone. I hope you enjoyed and have learned something. And rest, see you in the course for having more detailed information regarding it.